My colleague Onesimus Mlewa Kalama will be moderating this session, and he will take us through the objectives of this session. He will also talk a bit more around the rules of engagement. But we have a very exciting two-day session starting today and tomorrow, 2 hours each session. And we are very happy to co-host this with Impact Sante. So with that, I would like to say thank you so much and hand over to Mlewa, who will take us through the whole process. Thank you so much, colleagues. Mlewa, over to you.
Thank you, Olive, and thank you, Olivia, for actually setting the ball rolling. So as normal with the Zoom calls, if you have a question, please, you can put it down on the chat box. And at one time, probably we'll be able to listen to a few more people as well. So we'll actually be co-moderating this call with Olivia. And most of the time you'll either hear me or Olivia actually calling on the discussants or panelists to provide their presentations. So please feel free to put to write in the chat. You can as well introduce yourself on the chat, your name and the organization you're coming from, so that we can be able to know who is actually on the call today. So on that, I will want to say thank you very much, and probably now call in Shishu to be able to take us through the next presentation. Welcome, Shishu.
Thank you very much, colleagues, this morning. We are at the Global Fund. We're excited to join all of you to be able to give you an overview of how the Global Fund works, and what are some of the points for the civil society engagement. So I will start off by talking about how the Global Fund is a partnership organization. At its core principle is, partnership with government, civil society, communities affected by the diseases, technical partners, private sector, faith-based organization, donor funders, as well as what they call Friends of the Fund, which are organizations that are posted in some of the G7 countries to help with, resource mobilization and also collect intelligence for the Global Fund. So the core principles of the Global Fund are country ownership, performance-based financing, which means, you get funding based on the results that you're producing at country level. Country ownership is a very important element where we want countries themselves to design and implement their own countries and to hold themselves at accountability and looking forward to sustain and own their own programs in the future. And then, of course, the whole partnership is based on transparency, whether it is, external or internal. So the Global Fund, how the Global Fund works is that we at the Secretariat, together with partners, we raise money and invest more than 4 billion a year to support programs. So countries make the investment decisions, the Secretariat reviews and approve, and then we have local experts that implement those grants and programs. We also have an oversight mechanism both at the global level and the regional and the country level. I hear some, can you please mute? Some interruption.
Sorry,
So,
we meet John.
Thank you. So, just to say that at the oversight part, there is a local fund agent at country level. They serve as the eyes and ears of the Global Fund. And then at the global level, we have what we call the Office of the Inspector General, where they go by and do audits, spot audits. If they hear any kind of fraud, corruption, or there's whistleblowing, they're the ones who actually make the investigation process. And then to talk about, where are the programs? If you look at the overall resource allocation of around 72% of disbursements goes to sub-Saharan Africa. So you see it's a huge chunk of money, most of it concentrated for HIV and malaria in more than 100 countries. And then the rest is spread out between, Asia is 20% of the resources. And then you have Eastern Europe, Latin America, and then the Middle East, North Africa, and the Middle East. So how is the Global Fund funded? So the Global Fund has a 3-year funding cycle to ensure that it brings predictability and allows implementing partners to plan effectively. As you recall, in the previous time, it used to be round-based, where it wasn't really predictable. Countries would just apply and see if they would get. But now, there is an allocation process that's based on methodological calculations that includes, the disease of burden, willingness and ability to pay of the country, etc., that they use to be able to allocate resources for each country. And then it's a 3-year pledge that is made by the contributing donors at the replenishment conference. And 93% of these resources come from donor governments. So basically, big of the G7 countries, with the first donor being the US, second France, third UK, fourth Germany, and fifth Japan. So these countries make up 93% of the resources that comes to the Global Fund. And the rest comes from, private sector, as well as, and I'm happy to report that past and current recipients of the Global Fund resources are also Global Fund donors. And I'm happy to report for this replenishment cycle that just passed in October, there were 24 African countries that contributed to a tune of $77.5 million. And this was like 141% increase from the last 3-year period. So you see there's huge movements from within our region. How does the Global Fund operate? So the Global Fund has a board. Under the board, there are high-level coordinating groups, and then under them there are committees. So the first committee is on the strategy. This is the committee that looks at the strategy and endorses all of the strategies and policies related to the Global Fund, and then it puts it forward to the board for endorsement. You have also the Audit and Finance Committee that looks at all the financing and resource mobilization strategy. And then you have the Ethics and Governance Committee that looks into, ethics and governance issues within, the Global Fund. So that's really the board structure. Then at the Secretariat level, you have the Secretariat, and then you have the Inspector General. So the Inspector General is an independent office that has its own operating entities. And then the Secretariat has under them the CCM, which is sort of the governing mechanism at country level that actually mirrors the board. And then you have the LFA, the local funding agent, which are the eyes and ears. They do all the follow-up on financing, they do the audits, etc. And can also work with the IG. And then you have the principal recipients, which are who actually implement the grant. And these principal recipients can either be government, can either be private sector, can either be civil society. But of the most you see are governments and civil society. And then you have also sub-recipients and then sub-recipients, which tend to be more civil society, low going down into the communities. And then the sub-recipients will be, communities, organizations that are closer to the people. And then the Global Fund usually develops a strategy every 3 years. We have a strategy currently that's running from 2017 to 2022. The key objectives of this current strategy is maximizing impact on HIV, TB, and malaria, building resilient and sustainable health systems, mobilizing increased resources, and to promote and protect human rights, gender equality. As you know, currently the Global Fund is in the process of elaborating its new next 3 years strategy. I know that you are all engaged in the consultations and the discussion. Unfortunately, those discussions happen through the partnership forum, and the partnership forums have been postponed due to COVID, but there have been some online consultations and discussions. And we do hope with COVID-19, maybe a vaccine coming or other therapeutics, that next year in 2021, we might be able to hold those meetings in person. But I encourage all of you and your constituencies to really get involved, because this is where you can make a difference in terms of what are some of the key issues that you would want to see going into the strategy, and elaborate those so that the Global Fund takes them up and is able to debate them in their next strategy committee and in the partnership forums as well. Through the strategy, we have been able to achieve 14 million lives saved in 3-year period, beginning in 2017. We have averted new infections to the tune of 194 million people on HIV, TB, and malaria. We have been able to catalyze domestic financing for health to the tune of $35 billion through the co-financing policies, but also governments themselves with the advocacy that we are all doing on increasing domestic resources. Though I think these achievements might be upended because of the COVID-19, where most governments are now redirecting their resources to COVID treatment and prevention. So it's something that we would all have to monitor and see. And I think in the short term, there will be huge impacts because there's huge shocks to the economies of these countries. And it means, you know, shrinking base of revenue raising and resources, and redirecting those resources to COVID-19. And I think part of our work is to ensure that we work with countries and to ensure that there's a balance between, you know, what they're doing for COVID-19, but also not neglecting HIV, TB, and malaria and other services. And so I think because of the aversion of many deaths, premature deaths and morbidities, the Global Fund also calculates that we have been able to drive economic gains to the tune of US $230 billion, particularly in the low and upper low income countries. So what are the ways to engage for civil society with the Global Fund? There are several mechanisms that allow us to engage with civil society. So one is on the resource mobilization. So we work very closely with all of you, including the GFAN platform, the GFAN Africa, the Asia Pacific GFAN platforms at national level, doing some of those national campaigns to be able to raise resources for the Global Fund, particularly around the replenishment years. But even now, we would need your voices more, because we're also in the process of raising resources for COVID-19, while at the same time, you know, ensuring the balance between HIV, TB, malaria. But it's also those COVID resources will also help to ensure that those essential services are not getting left behind. So those are the and then the other part is, you know, through grant implementation, if you will, through the CCM, the country dialogues on the grant application process, and then the grant making and grant implementation, where a lot of civil societies are principal recipients, are sub-recipients, are sub-recipients. So there's a lot of opportunity at country level to be able to discuss. Some of the CSOs sit on the CCMs. They partner with governments to help implement parts of the grants So enormous opportunities there. Then the other part is through the Community Rights and Gender Department, the Global Fund. They work on thematic areas such as, key populations, young women and girls, they support civil society on grant implementation. They provide technical support. There are platforms, and I think some of you are current platforms for TA provision, but also having a platform where civil society can debate and discuss issues that are pertinent and relevant to their communities and their constituencies. So I think with that, I will stop. If there are any questions, I'm happy to take. Unfortunately, I will not be able to stay. I have another meeting that's actually on, but I'm happy to stay on for 5 or 10 minutes and answer your questions if there are any. And then I apologize, there's no presentation, but we'll finalize it and ensure that it's circulated by next week. So over to Chair.
Thank you very much, Shishu, for that very elaborate presentation. So the presentation we've just been listening to, colleagues, is just been a presentation from the Global Fund, introducing the Global Fund architecture, including the funding cycle and opportunities for civil society to engage. So I think, as we are waiting for Emily to join in the right link, I know Emily has joined the call, but must have joined with the link for the participants. So I've just sent the link for the presenters where now she can be able to present. So as we are waiting for Emily to come in and do the presentation, then I will probably allow people to say if you have any urgent question for Shushu from the Global Fund right now, that will be okay. Otherwise, the upcoming session will actually be from the CCM Hub, where we will be talking about unpacking CCMs, the funding request development, and opportunities for civil society and community engagement. And then from there, we will actually be looking at sharing country experiences on malaria constituencies in country dialogue processes, as well as the grant-making processes, which will actually end our program for today. And then tomorrow we'll be having other exciting sessions that will be from the Community Rights and Gender Strategic Initiative. We'll be also having a session on introducing the Community Rights and Gender Technical Assistance. And then we'll also be talking about the Anglophone Africa platform, where we will actually be looking at how the platform work is supporting civil society to engage. And then we'll also have a presentation for civil society for malaria elimination. And then we will wrap it up with another round of questions and answers. So these are very good sessions, colleagues, you don't want to miss. Let's see if Emily has joined.
Yes,
this is Emily.
Yeah, so Emily, we were able to move her to the panelist link, but because Shushu has to go, we were wondering if there are any questions for Shushu, because Shushu has to leave now. So I don't know if anyone has questions. If you want to raise your hands, we'll give you the mic, or if you want to write on the chat. So we have Kenneth, Isaac, and Fiona, so we'll give you the floor. Starting with Kenneth. Kenneth, if you want to unmute your mic and speak. And we also have Isaac, Isaac Ampoma. If you want to unmute your microphone, please go ask your questions for Shushu. Thank you.
Yeah, thank you very much. This is Kenneth Mujanji, Executive Director of Integrated Development Center, northern part of Ghana. I just want to know when the next funding cycle begins, and thanks for the opportunity to be on this session.
Okay, thank you, Kenneth. So we'll take.
Hello, thank you.
Go ahead, Isaac.
Thank you very much. This is a very learning process. We are happy to be connected. I would like to find out from Global Fund, what has been some of the lessons when it comes to sub-recipient, technical support, and maybe overheads and administrative. That has been a problematic at the community level. Moving forward, what is the Global Fund doing about that? Thank you.
Great, thank you very much. Fiona, you can speak now, thank you.
Hello, can you hear me?
Yes, go ahead quickly. Yes, go ahead, Fiona, we can hear you, go ahead. You should actually unmute your microphone, Fiona, and you can speak.
Hello. Whilst the Global Fund has been looking at the gender dimension of issues, particularly looking at young women and girls, as the funding also looked at the impact of malaria and other sicknesses like COVID-19 on the lives of workers with disabilities, those that are living with disabilities. Has that been looked into, and what has been the responses of the Global Fund?
Okay, thank you, Fiona. Tomorrow we have the whole day is about gender in malaria, community rights and gender. So the whole day tomorrow is going to be about that. So we might actually save your questions, a very good questions, but we might save it for tomorrow, which is going to be about gender. But thank you very much, Fiona. I don't think, I don't see anyone, we don't see anyone else. So thank you for the questions. Shushu, the first question was, what is the next funding cycle? When does the next funding cycle begin? So the next Global Fund funding cycle begin. And the second question, what are the lessons learned, especially around SSR, technical assistance and overhead at the community level? Are there any lessons learned around those issues? And then the third question is about gender, if you want to respond to that. If not, we will take it, we have written down for tomorrow when we talk about gender. Thank you, Shushu.
Thank you, colleagues. So the next, with regards to the funding cycle, so the funding cycle happens every 3 years. So the last funding cycle where we were able to raise resources was in 2019. So the next one will be in 2022 in terms of the funding cycle, raising resources, etc. But the funding cycle for the countries, I think the countries are now with the new funding that we had received are in grant making for those countries that have allocated resources are currently in discussion on grant making. So those are the two issues. On the lessons learned of the technical assistant, I know that TAP and also CRG, because this is really CRG's, and I know that you have a call, somebody from the CRG coming in, because they do a lot of the technical assistance of the SR and SSRs. I would defer to leave that to that person to answer. But I think overall, though, there is a review currently happening with how technical assistance, just in general, not just specifically for communities, but how that has been happening between WHO, all the other technical assistance providers, the bilaterals and the multilaterals. And I think CRG would be in a better place to be able to share some of those lessons because I don't have them at hand. And on the gender dimension, I would also say that we are currently looking at what is the impact of COVID and what's the impact on malaria, what's the impact on women and girls. So those are already being looked at, obviously getting more information from countries to compile. And I believe in the next couple of weeks, as part of the COVID-19 resource mobilization efforts, you will begin to see some of those research and information that's being received from the countries out. But I also, again, would defer that to the question because CRG will be in the afternoon be able to provide that. Okay, so I think I would leave with that. I only one thing to note is that, you know, there are many shifting issues people talking about, global health security, people talking about climate change. So there's a lot of things that are happening, and it's important that communities and civil society watch the landscape of where global health and where the resources are going to be shifting, so that we don't lose sight on HIV, TB, and malaria. And as you see already around the world, the COVID-19 impact is actually re-emerging again after in some countries that have actually contained it. In our region, very big issues. So very important to keep that, to keep the intelligence, and also looking at how we're going to really enhance different ways of doing advocacy. And we're happy to be able, particularly for 2021 and 2022, as we move into the funding cycle, important to identify innovative ways of reaching donors, but also even philanthropy people within our region. So I will leave it at that. I'll be happy to join you guys in the next one. And I'm sorry that I have to leave, because I think this is kind of interesting discussion.
Okay. Thank you very much, Shushu. Over to you, my brother, Merwa, for the next introduction. Thank you, Shushu. Okay.
Thank you so much, colleagues. Bye-bye.
Thank you, Olivia. That has been really helpful understanding the Global Fund architecture. Now we are going to be unpacking CCMs, the funding request development and opportunities for civil society and communities, community engagement. And we're going to be calling in Emily Hafs from the CCM Hub to actually make this presentation for us. Emily, please, if you can come in, introduce yourself, let people know more about you, then please you just dive into unpacking CCMs and the funding requests. Thank you, Emily.
Good morning. Thank you so much. Thanks, everyone. I do have some slides, but I really, when I was invited to this, I really wanted to hear from all of you. So I'm really looking forward to that. I'm going to share my screen, and I don't know if I can see the webinar chat when I do that, but I will try to keep touch with that and go through these slides quite quickly. Again, I'm Emily Hughes, and I am the manager of the Country Coordinating Mechanism Hub at the Global Fund in Geneva, and it's really, really great to talk to all of you. I'm going to try sharing my screen just now. And let's see. Okay. And putting this in projection mode. 1 second. Okay, great. So I was asked to speak about country coordinating mechanisms and the opportunities there for the engagement. And my first response was, well, I want to hear what all of you think are some of the opportunities and some of the needs facing all of you in country. But I'll go through this very quickly and then again, look for your consultation. I wanted to start sort of very big picture, which is, that this engagement through CCMs from all of you and from all of our constituencies. I liked the way Shushu talked about CCM sort of being mini boards in countries. I think that's a really great observation. And that our executive director, Peter Sands, has talked about this too, and has talked about how essential your engagement, again, across diseases, including malaria, is so important to ending the diseases because of those insights, because of your knowledge and intelligence from the community level. So as many of you know who have been part of the Global Fund for a longer period, CCMs have always been part of the model for the Global Fund from the launching and kind of the core founding documents to now. And there have been various times where we've taken a closer look at CCMs around, how are they doing? Are they fulfilling that purpose of that effective engagement and oversight at the country level? And in 2018, there was some thought that we could look at the CCMs with a more evolved lens. The strategy has changed, the way the Global Fund work has changed and evolved. I think, as Shushu mentioned, country ownership being such a core principle but what about that sort of governance piece with the CCMs? So there was a look at that, and there was what we call a strategic initiative. So these are resources that we raise and can really funnel towards a specific catalytic opportunity. And so we looked at 18 countries through a CCM pilot to see what could we do differently with CCMs so that they can be more robust mechanisms for your engagement and really for the oversight, both of the development of funding requests for the Global Fund to End the Diseases, but also of the existing funds that are out there. Are they doing what they need to do? And so we finished up the pilot last year in 2019, and I'm just showing you a very brief overview of kind of where we landed on the results. And as you can see, there was improvement across the board for all of the countries and how they did in each of these areas, these 18 pilot countries. But specifically engagement, we didn't see the bigger jump. So we said in scaling out our intervention in the strategic initiative with the remainder of the CCMs and regional coordinating mechanisms, we really need to focus on this engagement, which is again why I was really pleased to talk to all of you today. So in this next phase, if you think about it, we had the pilot, now we're moving into the rest of the CCMs. Some key considerations that we're taking into account, and really important here is that these are key considerations that build from the pilot, from the results of the pilot that we did in 2018 and 2019 with CCMs, as well as consultation. And we've had various consultations through in-country dialogue, and many of you have probably been consulted on this, but how do we design it in a way that is very responsive to the needs facing CCMs, facing communities on the grounds, as well as the COVID context, which all of you are in the middle of. And so one of the things that we heard from a survey to our CCMs was really that the assessments often take a long time and require a lot of resources. So where can we minimize the burden of those? How can we ensure that interventions still work? One of the things that we talked about was where we're working with CCMs, it's not about doing the same thing and just doing it over Zoom. We need to do things differently. And in countries where it's possible to align with national structures, there's a lot of different platforms and a lot of, different partner platforms. Are there opportunities within the CCM to say, hey, we're kind of talking about the same issues here. Can we kind of combine some of this? And really, CCM evolution in general is really changing the business as usual, and to really equip CCMs to be the responsive and robust governance mechanisms that are brought forward. So I just want to provide this overview of what this will look like in countries moving forward. So you have sort of, instead of, again, a heavy assessment, you have a very light threshold. Where are countries, where is the CCM doing well? What are the opportunities to improve? And to really move quickly into some interventions. And again, this gets into some of the feedback that I'm hoping from all of you. And then looking at the results. How did we do? How are CCMs doing? And one of the pieces that I'm hoping we can talk about a little bit today, and I think perhaps part of the reason I can be here with all of you is really that engagement opportunity. And as the constituencies, particularly from the malaria communities, come into that space, into the CCM space, how can we get beyond that representation and have that meaningful participation? And so this slide here just shows you, and I'm happy for these slides to be shared with all of you, but it really just shows you a couple of areas that we're really looking at to invest in with this strategic initiative. So really looking for all of you to be engaged in this. And our next steps, as I promised, this will be very short. Our next steps are actually launching CCM Evolution with 6 CCMs. And again, we have a smaller, this wave is a new starting point, only in the sense that, because we adapted a lot of our interventions from the pilot, to the more virtual context. We just want to make sure that those are all working well. And then we'll move across, and you can see here it's about 90 CCM. So for the CCMs in which you engage, they should, unless you were a pilot CCM, they would fall into that. And we're confirming those with countries based on, what's going on in country and developing the funding request or other key pieces. So I'm going to stop there. I had some key discussion points. I see some things in the comments, so I'm going to escape and hear from all of you. Okay, I see some comments. Chair, should I turn it over to you to direct the Q&A and feedback?
Sure, please. Thank you very much, Emily, for that presentation. So probably before we read the comments, if there is a quick question, Olivia, from your side, if you're seeing anybody with their hands up, so that we can pick one or two feedback on the presentation before we look at the write-ups in the chats.
Yes, so we have Mr. Adeyemo, who has Dr. Adeyemo has his hand up, and then we have Kenneth again. So Dr. Adeyemo will give you the floor. If you can unmute your mic and ask your questions, please. Thank you.
No, I think I will let my question go. Thank you.
Hello?
Okay, thank you. We have Redmi. Redmi, you can ask your questions.
Good morning to everyone.
Good morning, Remy.
Are you hearing me?
Yes, we can.
Are you hearing me? Okay. Now, my question is on the virtual approaches to community engagement in view of COVID. Majority of us work in very rural communities where we don't have these virtual opportunities. In very rural communities, no light and all that. So I've been wondering if they can expatiate more on how we can be able to do that in those rural communities. Thank you.
Okay, okay, we have noted the question. So anyone has a question on the CCM, particularly for Emily? We have Nancy. Nancy, please, you have the floor. You can ask your question about CCMs.
Thank you very much. Yes, be glad if the presenter can throw a little light on the virtual way for the CCM. And the explanation was not too clear to me. And what is hoped to achieve? Thank you.
Okay, thank you. So Emily, I hope you noted the questions about the question from Nancy. I don't know if you have anyone else. Redmi, you can have the floor, please. Quickly, thank you.
Hello?
Yes, go ahead.
Yes, Rumba Matthias Suna from Uganda. I'm really concerned the microphones are too low. We are finding a problem in hearing some of the presenters because we don't want to miss anything. Kindly maybe get closer or raise the microphone. Thank you.
Thank you. We can actually hear well from here. So maybe if you can check your sound of your device. We are hearing everything very loudly from different places. So please check your sound as well. I don't know if we have any other questions. So I think that's it. Emily, I don't know if you want to read anything you saw on the comment, and then it's up to you. I mean, it's back to you, Emily. Thank you.
Thank you so much, and thanks for those questions. I hope everyone can hear me. Normally, I'm pretty loud. I think great questions, and thanks for those of you who I'm looking at comments. And again, I'm always available if you have any other follow-up questions. But so the virtual opportunities for those at the community level who may not have access completely agree. And in fact, that's what I meant by the comment saying it's not about taking all of the things that we were going to do before and moving them to Zoom, because I agree, you will leave too many people out, too many voices out. I think that's such an important piece. So in fact, what we've done to sort of take this into consideration is that we want to engage different types of partners. And so we've been working with our CRG colleagues and their strategic initiative as in terms of how we could invest in some of the regional platforms and networks directly, so that it's not just about working with them, it's actually having the regional platforms and networks be the providers themselves. So that, again, you're saying this, that the cohort that works on CCMs can be the very networks and platforms that are in many of these countries. So that's kind of what we're working on. We're really excited. We're still working closely with CRG and some of the procurement issues, but we're really, really looking forward. Sorry, Community Rights and Gender Department at the Global Fund. So I really am looking forward to that. And I think that's a really important point. The second question I heard is, what is the objective of CCM Evolution? And I apologize, I think just in my brevity to keep it short, I wanted to kind of move right into what the engagement pieces are. So CCM Evolution, again, was two phases. The first phase was a pilot phase. And the objective was to say, how have CCMs evolved with an evolving strategy, with evolving epidemics? Are CCMs still working in the same way? And the other point on that was CCMs are often in this point of saying, oh, we need technical assistance to do oversight. We need technical assistance to do the elections and constituency representation. And we said, are there ways that we could equip CCMs themselves to do these things and work a little bit differently? And that's what we're calling the evolved model. So the pilot was to try different interventions with CCMs to see if we could, in fact, have CCMs be more mature bodies in terms of that health governance role. And we found out some really helpful interventions to do that. And then what we're doing now, the objective again, to equip CCMs to be part of this health governance infrastructure moving forward, which is about the diseases, is about emerging health pandemics in that governance role. And so we've been working with CCMs. So now we're taking what worked in the pilot and scaling that up across CCMs to ensure that all CCMs are more effective governance platforms for engagement and oversight. I'll stop there. Scaling that up across governance.
Okay. Thank you very much,
Emily. Go ahead. Okay, thank you, Emily, for that presentation. I really haven't read much questions from the chat, apart from presenters asking if we can be able to share the presentation that has just been made, and I think we should be able to share this, Olivia.
Yes. Just to reassure everyone, all the participants will receive the link to all the presentation made today, and we will also have the link of the audio of the webinar that we're going to share with everybody.
Thank you very much. So participants, rest assured you're going to receive every material that's going to be presented here. So now we're going to go into getting some real experiences from the countries, sharing experiences of malaria constituencies in the country dialogue processes, as well as the grant making processes with the Global Fund. And we're going to actually get experiences from Kenya, Rwanda, Uganda, Zimbabwe, and Nigeria. Edward Mwangi, who should actually have started this session, said he will be joining a little later, but he'll still make his presentation because he was in another meeting. So when he joins in, he'll actually be able to make his presentation probably as the last person. So we are going to go to a presenter from Rwanda, that is John. John, if you are ready, please take on the floor and share with us experiences of Rwanda on malaria constituency engagement in country dialogue, as well as the grant making processes. Welcome, John.
Thank you very much, Milewa. First of all, I just want to thank you for this invitation and also to show you the problem status of malaria in Rwanda. You'll note that Rwanda was doing well before 2011, but starting with 2012, the incidence increased from 48 per 1,000 new infection in 2012 to 403 per 1,000 in 2016. If you look at the Rwanda Malaria Indicator Survey of 2017, done by the Rwanda Biomedical Center and Ministry of Health, malaria prevalence in the general population is 7%. It is also 7% of children aged 6 to 59 months, 11% of children aged 5 to 14 years, 5% of women aged 15 to 49 years. And when you look at the risk at a geographical point of view, you find that the eastern province of Rwanda has the highest risk of 17%. So the target population for malaria interventions in Rwanda is general population, and then the pregnant mothers and children under 5 years. Strategies, according to the malaria strategic plan, is the indoor residual spraying, insecticide-treated bed nets, and of course, case management. So there happens to be a gap between access to bed nets and use of those bed nets to actually control malaria infection. And that's where the government requests civil society to intervene and support in actually behavior change for the population to respond to malaria prevention. Now looking at the engagement of civil society in the grant making process and in the country dialogues. We have a CCM in Rwanda and the Rwanda NGOs Forum, of which I'm the director of programs, of which I work for, is represented in this. The government is the principal recipient. The forum is one of the umbrellas in the health sector. Is also a sub-recipient, and some other NGOs getting support from the Global Fund are sub-recipients. However, most of these sub-recipients have been getting fund to fight HIV. So in our constituency meeting, they have not been actually getting funds for malaria to fight malaria. So in our constituency meetings with members of Rwanda NGOs Forum, we've been asking them not to wait for funds to fight malaria. In case they have funds, where they have funds to fight HIV and they're meeting their beneficiaries, they should also talk about malaria prevention. That has been one of the strategies we use in Rwanda NGOs Forum. About the country dialogues on malaria, actually, apart from maybe the umbrella like Rwanda NGOs Forum, you will find that very few NGOs participate in the country dialogue and the grant making process. the CBOs, actually, those small organizations in the community, are not even aware of what is going on. They just get some information after maybe the grant has passed through. When we go to the field and explain that there is a grant to fight HIV, TB, and malaria. So they are not really fully involved in the process of grant making. In the counter dialogues, the space to give their own views is not all that sufficient. We therefore find that there is need for CSOs in our country to have a larger space to get involved in the national dialogues on malaria and the grant making process and the Global Fund, processes, to ensure that the strategic plan and all stakeholders' interventions on malaria consider the gender dimension, the human rights, key population, vulnerable women, and the children, to ensure the correct and consistent use of mosquito bed nets, which is a problem now to the country. And I think CSOs can contribute significantly to that. So thank you very much.
Thank you, John, for that presentation. What we will do for this session is we have about 10 minutes each presenter, and thank you, John, for taking about 9 minutes to make your presentation. So we are going to be taking all the presentations from the community, and then we are going to respond to any questions that will be coming from as a group. So we will not be receiving questions per presenter, but we will wait for all the presentations to go, then we can take questions. So at this moment, I wish to welcome Prince Mulumba from Uganda to actually share the experiences of malaria constituencies in the country dialogue processes as well as in the grant making processes. Welcome, Prince.
Thank you, Chair. I think I'm audible enough.
Sure, you are very clear.
Okay, thank you. Once again, I'm Mulumba Matthias Suna from Uganda. I'll be very brief. I'll not give the background, but I'll go straight to what I was supposed to present. In Uganda, I support the malaria network, which is called MASIS, Malaria and Childhood Illness CSO Secretariat. As an expert, I support them, especially at this time when many NGOs have had challenges in resource mobilization and others. But I head an organization called CEPAD, which is an OD organization. I got involved right from the very start, personally, and again through the network. We try to bring on board as many civil society organizations as possible, both sitting and writing, but also from the background of consultation and going to them. The process, I think, is similar to all the other countries. We started.
We are losing you, Prince.
From the plan, the malaria strategic plan, which, sorry, I think I jumped off a little. Somebody was calling. I'm using my phone, I'm in the field. So we brought on board the CCM members. We brought on board some other few organizations that were doing work in malaria. And we got involved in the strategic planning making process. And then we also had meetings of the General Civil Society Coalition Group, where we brought on board different civil society organizations. At application level, of course, the numbers were limited, but we managed to at least have at least 3 people who were consistent through up to the grant making process. The 3 of us involved, me and also the 2 CCM representatives, but there were also other civil society organizations, especially in HIV/AIDS. Uganda HIV/AIDS civil society organizations have done a great job and there were several right from their different constituencies. So they were supporting, giving information and supporting. We used to have meetings almost every evening during the writing process with all the others, TB and malaria and HIV, and we could get information and discuss, and then they could support us where we needed some information. Right, go to the challenges that we faced. Most of the challenges we faced were, you know, if you're dealing with government normally has its systems and ways to work with the people. For us as civil society, some of us who participated were self-sponsored, for example, and you needed to go maybe for a week of writing, and then sorry, my phone has challenges. Some people were supported through different ways, like Yanaso mobilized some money through Uganet, which supported some members of the civil society. But for malaria particularly, we didn't have any such support. And we think maybe in the next writing, we can always get it. Then the other issue that really was troubling was that we had many aspirations. We had many ideas. We had a checklist of what we did. We made priorities. But towards the end, it was a struggle to maintain some of these priorities within the grant. Of course, government has its priorities and the strategic plan. We contribute to the priorities, but saying this is civil society, what civil society can do is a bit challenging. Lastly, with the system that has been set up in Uganda, we have TASO, which is the second recipient from government, which is a civil society, and supposed to work with the sub-recipients. Now, the sub-recipients have mainly, as TASO's background have been working mainly in HIV/AIDS. We don't have any sub-recipient that is very conversant with malaria activities. So we have challenges in that line, and we are struggling to ensure that probably in the next grant we can apply and have a sub-recipient. This is very, very important because towards the end, you'll find that activities that were supposed to be for malaria maybe are implemented by government, which could have been for civil society to really support civil society. So we are challenged in that way, and we hope we shall get a lot of support. We don't have technical assistance as civil society organizations in malaria, and many Uganda civil society organizations in malaria in Uganda are weak. We are not really working towards that. I'm right now in the field, we are distributing mosquito nets with the ministry, but you struggle to find civil society particularly working on malaria. So we need that type of technical assistance. Thank you, Mulewa. I don't want to spend any more time. Thank you.
Thank you, Prince, for that brief presentation, but quite right on point. Patience Banda from Zimbabwe. Patience, welcome, and take us through your experiences. Hi, Patience. Hi, Patience. Yes, please, the floor is yours, Patience.
Morning, everyone.
Good morning.
I want to correct my name first. I'm not Patience. I'm Elizabeth Spanda.
Oh, sorry for us to have mistyped your name. Sorry,
Yeah.
Elizabeth.
Elizabeth Spanda, a CCM member and the chairperson for malaria in the CCM board. I've got a short presentation which I'll make. I think I'll take less than 10 minutes. Malaria was located 23,771,855. Can you see my presentation?
Yes,
Yes,
we can.
your presentation, we can see it.
You can see it.
Presentation, very, very clear.
It's clear, okay. Firstly, on CSO involvement, the challenges which we have, handover processes, they need to be improved. There is need for more community engagement before concept notes, writing to gather information. We know that funds won't be there, but I think in future that's what we need. Local CSOs need to do more, hence government will then medicalize malaria and make sure as CSOs feel we are not relevant. Experiences, CSOs involvement. It works well to closely work with the outgoing previous CCM's members for continuity purposes. Secondly, a few international NGOs are benefiting from. Most local CSOs only started to see relevance late, that we can do demand generation through awareness raising in the malaria-prone zone, even during this COVID time. Future recommendations, CRG to support community dialogues that encompass HIV, TB, and malaria for us to remain relevant. CRG to support handover and takeover for outgoing and incoming CCM members. Income CCM members to value the outgoing members since we serve the same community. I think my presentation ends there.
Yeah, your presentation ends there, Elizabeth, unless you want to say one more three things about the presentation. Otherwise, thank you very much for the presentation, Elizabeth. And after the full presentations, then probably we'll be receiving questions that maybe you'll be responding to.
Okay.
So we'll be going now to Nigeria. If we can have our speaker from Nigeria come on, please, that will be appreciated.
Okay, good morning, colleagues.
Good morning.
Okay, can you hear me well?
Yes, yes, you're very clear, Ayo.
Okay, thank you. My name is Ayo Ipinmoye, National Coordinator of HACOMIN, which is the network of NGOs involved in malaria in Nigeria. I will share from my experiences a little, but I will prefer to spend more time presenting more of our lessons learned. Hopefully, maybe some of our colleagues from other countries can learn from our experiences. What Nigeria is currently, the next grant, we're on a grant continuation track, which means that Global Fund adjudged that what we as a country are doing currently is working. So we should just continue for the next 3 years. On a scale of, we're not having a change of strategy, but we are going to be increasing and improving in what we do. And currently the strategies that are being deployed in Nigeria are prevention using the long-lasting insecticidal treated nets. That's been distributed through mass campaigns and routine distribution. We have the case management ongoing, treatment for malaria using the ACTs, the different varieties available. Then seasonal chemoprevention is being done in all the Sahelian regions in the north of Nigeria, in 4. But now in the next track, it will be done in all of the Sahelian northern states of Nigeria. Then we have the preventive treatment for pregnant women, then community mobilization for uptake of commodities, and lastly, community-led monitoring, which is the accountability and advocacy being done also by civil society to hold both ourselves and government and partners accountable to their deliverables, accountable for domestic resourcing and all these other issues. Now, the civil society in Nigeria have a seat on the table. We are members of the CCM and members of all the strategic committees at the national level and also at state level. We have advocated and fought for this and obtained it, and it has helped us because having a seat on the table means that we are part of the decision making. We are not outsiders, we are part with, and we are able to make our presentations. Then, of course, we participated in the development of the country concept note, and we are participating in the ongoing grant making. One of the things that's helped us is that we go there, like I said, we have a seat on the table, and we do the work ourselves. We write the proposals, we have learned to read and digest the guidelines from Global Funds, we develop the activity lines, we do the budget, and then we argue it out with the rest of the partners. Developing country proposals is a very political process. A lot of horse trading goes in. When we are presenting data and we are working with statistics and people are saying, well, this is what the data says, the issue is that data can tell any story. Which data do we use? How do we prioritize for the country? Who does the prioritization? If you are not part of that process, I can assure you that your issues will not be prioritized. One of the things we have learned and we do in civil society is to say that nobody goes there to work for us. If we do not work for ourselves, then we do not expect that the partners, the WHO, name them, all these wonderful organizations, all the wonderful government agencies, all the wonderful partners, they have their own agenda. And so when they are writing country concept notes, they are not particularly thinking of when I say they are not particularly thinking of our own priorities. They have their own priorities. So the most important task for civil society is to struggle to get a seat. It might mean that we form coalitions and networks and trust ourselves for our leaders to represent us. But other than that, if we go as individuals, you will not be granted entrance. Then going forward, we need to get involved in the process. If you just show up at the point of proposal development or country dialogue, you're already too late because most of the work had been done before then. If the country dialogue or concept note will be written in June, I can tell you that June the previous year, all the priorities are being set. All the targets are being developed. The data is being put in place. So by the time you show up, you have nothing to speak to. So we have to be involved in the processes before the country dialogues, before the concept development, etc. Then when we are in the country dialogue and all these processes, our normal civil society combative approach alone does not work. We cannot go there and rabble-rouse and bang the table and blackmail and shout. That is not what works. What works is we need to have the political skills. You need to be able to lobby. I can assure you, all of these international organizations, even the partners, multilateral and bilateral partners, they have very strong lobbying skills and they deploy those processes to ensure that their own issues are captured. We need to develop that. Number two, we need to have the technical skills. So when we are sending people to represent us, we need to look at two things. the political skills and the technical skills. Both of them need to work together. And we need to be tenacious. It's not something you go 1 week, 2 weeks, and then you drop out. Sometimes the doors will be slammed on your face, then you open the doors and it's changed, you go back and redo it. So we need to be tenacious. And lastly, what I will also say is, I will advocate for colleagues across the continent to look at adopting the performance-based funding. Currently, one of the things they have in currency is that the civil society organizations are not, we are not credible. There are usually issues of retirement, our reports, our receipts, and all the documents we supply. So what we have done in Nigeria that is giving us a lot of credibility and rest is to adopt a performance-based funding approach. You work and you are paid for the work you do, period. All of those issues about bringing receipts for water, bringing receipts for taxes, bringing receipts for electricity are out. And that's where we normally get into trouble. So if we, maybe I will speak with Olivia, if we can look at this, maybe in one of our further meetings, if this is something that we can look at as a continent. And I know that Global Fund Secretariat themselves are looking more at this issue. So if we do a performance-based funding, it enables us and global funds to rest because the contentious issues of financial documentation is put to rest. We will focus on our work, we do our work well, and then we are paid for it. It's like you go to your tailor sews a piece of cloth for you. You do not go back tomorrow to ask what they did with their money. It's none of your business. So it's the same thing when we work, they pay us, we go to the next thing. Our people are very good at what we do in the communities, but we are not very good in financial record keeping and financial management, which is what puts us in trouble. So changing the approach of how we do things will help us, will help Global Fund, and will give us greater credibility going forward. Thank you. I stop here.
Thank you very much, Ayo, for that presentation. And just stay put just in case there'll be any questions related to your presentation so that you can respond to them. We have a presentation from Kenya now. Edward, is Edward online now? Edward Mwangi? He had said he was going to join a little late because he had another meeting. I think Edward has not joined yet. So probably at this particular point, we will allow comments and questions to the community presenters as probably Edward joins us at some other time. I've just sent him a message so that he can make his presentation as well. So Olivia, if you see someone who has raised their hand from your side, if we can have take a couple of questions to the community presenters.
Yes, thank you very much, my brother. Thank you, Ayo, and thank you all the speakers for the sharing your experience, Patience, Prince, and everybody. Thank you. So we have Hassan. Hassan, please, you can unmute your microphone. After Hassan, Anna. And after Anna, we have Isaac. And after Isaac, we have Josephine and then Tosin. So Hassan, you're first. Please go ahead.
Okay, thank you very much. It's Hassan Ibrahim from Kano, Nigeria. Well done for the I just have a question. You know, I get confused sometimes when we are conducting the advocacy because sometimes advocacy and lobbying it's a kind of thing that sometimes people are rejecting lobbying, and then some other part people are welcoming lobbying during advocacy. I would like Mr. Ayo to shed more light on lobbying. Thank you very much.
Okay, Hassan, we had a little bit of hard time to hear you. But I know you have a question for Ayo. So if you can also please write that in the chat, and Ayo is going to respond to you, or if you want to repeat, please.
Okay, let me quickly repeat it. What I said is that...
Good morning.
Sorry, Anna, 1 second. Thank you. We'll let Hassan just repeat his question. Thank you so much.
I want to appreciate you people for the presentation. As we put in the chat, we were unable to connect on time due to technical logistics. And on getting in, we were unable to hear you well. And I'm pleading that please, can you share the materials with us so that we can follow up?
Okay, no problem, Anna. We will share all the materials with you with the audio of the webinar as well. So
Thank you very much.
No problem, sister. No problem. Okay, Hassan, go ahead, please. If you can repeat your question for Ayo.
Hello?
Yes,
Hello? Can I go ahead?
Yes, go ahead, Hassan.
Okay, quickly what I said is that I would like Mr. Ayo to just shed more light on I know sometimes we got and lobbying. I would like Mr. Ayo to shed more light on lobbying and advocacy.
Okay, so more light on how to lobby.
Yeah.
So I think what I also would like to add, I'm Isaac from Ghana. What Ayo just said is indeed the crux of the matter. Civil societies at the local level has staff at their office and they also pay. So moving forward, I think some of these things need to be checked. And also some overhead costs needs to be arranged. When that is done, I believe reporting wouldn't be a problem at all. Thank you.
Thank you, Isaac. We have Tosin, go ahead, please. Tosin, please go ahead. And others, please mute your microphone. We have Tosin, and then after is Josephine. Tosin? Okay, Josephine, if you are ready, go ahead, please.
Okay, good morning.
Isaac, you can mute your phone, your microphone. Go ahead, Tosin.
Can you hear me? Good morning.
Very faint.
Yes. Tosin, can you speak louder?
Okay, so my name is Josephine Saki from Ghana.
Yes, hi, Josephine.
Hi. So I have questions for three of the speakers, for the speaker from Uganda, Zimbabwe, and then Ayo from Nigeria.
You need to do your phone, your microphone, please. Thank you. Go ahead, Josephine.
Okay, so the speaker from Uganda indicated that there are no CSOs, either none at all or very few CSOs working in the area of malaria. However, in the area of HIV, there are many CSOs working. I would like to know why this is so. And to the speaker from Zimbabwe, for her recommendations, one of them was the incoming CCM members should appreciate the outgoing ones. If she could throw some more light on exactly what that means and what she expects from the incoming CCM members. And then to Ayo in Nigeria, to add also that I agree with the issue of performance-based payments. I think it would uncomplicate a lot of issues. But he also mentioned that community-led monitoring is working well in Nigeria. In Ghana, it's a vexed issue. And so I would like him to share more light on some of their best practices so that we see whether we can also learn from them. Thank you.
Okay, thank you very much, Josephine. Very good questions. We have a last person. We have Simon. Simon, sorry, I'm saying it in French. So Simon, if you want to speak. Go ahead, Simon. Okay, Simon and Peter, maybe you want to write your questions on the chat, please, and then we will make sure to answer those. So I'll give the floor to Ayo and to the speaker. Please respond to the different questions. So Ayo, sharing your experience and light around lobbying and advocacy.
Okay, thank you. Thank you, colleagues, for the question. Okay, good. Now, lobbying is one of the tools of advocacy, and it's extremely important to what we do. You know, pulling someone aside, meeting someone who's a decision maker, who's an influencer, and trying to persuade that person to see your point of view is simply lobbying. We may visit the office of WHO, the UNAIDS, and share our perspectives with them ahead of the meetings, so that by the time they come to the meetings, they become our champions to see our broad issues as their own. And when we lobby,
Okay, I think they can unmute me. Yeah, they can unmute me from the control room.
Okay, thanks. Okay, so one of the things that we have seen that works is when we coordinate our issues and our asks, it works better. Where lobbying fails is when we have a multiplicity of issues that we're asking. This NGO goes ask for himself, the next person goes ask for themselves. The partners and the decision makers become confused. It's like we in civil society, we do not know what we need or what we want. But when we harmonize our issues, then our lobbying becomes quite effective. Then, talking of lobbying, we only do not just lobby locally. We also need to lobby internationally. For instance, if there are issues that we need to be able to speak to the Global Fund Secretariat, speak to international partners. All of those are lobbying, but they are not self-centered lobbying that we do that is counterproductive. So coordination, harmonizing our issues, prioritizing the issues, and then picking a few strategic issues rather than the small issues that we oftentimes spend a lot of time on. Then I've talked about coordinating and harmonizing our issues. And so that's what it does. Let me also say this. There was a time, sometime in the past, that I worked for a UN agency, which I will not mention the particular one. I worked in the office at the national level here for a while. And I found out that within the UN agencies, before they come out for meetings, they would have met and harmonized their issues. They have lots and lots of differences between them. There's a lot of infighting, to use the word. But before they go out, they would have done their first trading inside. So by the time they come out, they are all speaking with one voice, and you think that they are these wonderful people who don't have differences. Yes, they do. But they have learned to harmonize, to disagree, and it's what they agree on that they bring out. But we, civil society, We are yet to learn that. So that's one of the things that we need to learn from them. Let's have our disagreement inside the house. So when we go out, we speak with one voice. You will find out that even at country level, we will have everything we need in a short while. Even if not everything, we begin to move forward faster than this. And let me also tell you this. It is the resources that are due to the communities and civil society that government agencies usually use. Because we have not learned to harmonize and to present a common front to take what belongs to us. So because we are scattered in our approach, it is easy for us to be defeated. Then let me go on to the issue of community-led monitoring. What we have done everybody, including government, partners, the communities, the local government, and then even the NGOs accountable in 4 areas. One is the commodity utilization. Communities are being given resources. How well are they utilizing them? Because a lot of the things we do in malaria does not work because the communities do not use the commodities for what they are supposed to do. For instance, the LLINs are being used for fishing, for clothing, for all kinds of things. So community members need to be held accountable, otherwise all the work that we are doing will not work. Value for money, the money that Global Fund and governments are spending, somebody needs to check and be sure that those things are actually achieving the result they are meant for. Another thing is domestic resourcing. And so we have these 4 areas that we are focusing on. And then the community-based organizations have tools that they go and engage with these partners. They ask questions from the community members. They ask questions from the service providers. They ask questions from observe what is going on, and they check using all of these tools. And when they find, but the different thing that we do is when they find something that is not working, they just do not write a report and send to Abuja or send to Geneva. They immediately engage with the decision makers at that level with advocacy so that those services that are supposed to be provided will be provided. So we are not just monitoring and writing reports, we are monitoring and taking action to bring change at the local level. And it has been tremendous. I will resist the temptation to go into that because we take all our time. But that is what we do. Now, on the performance-based funding, again, like I said, maybe if Olivia would grant us grace, maybe sometime in the future, in the near future, we can come back to speak about that. But it's simply that the work that we do is now divided into little bits. So you are paid a certain amount for each work you do. So from the network level here, we work that out with Global Fund and with the principal recipient. And also we devolved it down to the CBOs who are actually implementing. So what they do is they do the work and we pay them for work done, period. So what we get from them are the reports of the work done. And when the work has been done satisfactorily and the deliverables have been met, the means of verification has come in, they are paid, and we move on. And so we are not collecting payment invoices largely, only in a very tiny little way from our CBOs. So that has freed us and freed them. So instead of spending all their time talking about the financial retirements, invoices, what they spend their time on is actually doing the work that they are supposed to do. There's a question about domestic resourcing. Now, let me give just a quick example. In Nigeria, the local government is supposed to hire and pay for staff and workers at the primary health care centers. What we find is that what we find is that in many instances, the local government agencies may not be actually recruiting the staff that are supposed to work in the PHCs. So when the CBO and all these, the CBOs who are working in those areas now link up with the local government and let them know that in this place and in this place and this place, we were there, but we do not have the staff. And the local government officials now recruit and send staff to those areas. That is domestic resourcing. We have many, tens and tens of examples where the communities themselves are now building the primary health care centers and commissioning them rather than the government. That is domestic resourcing. But one of the things that we are also struggling with is that reports of these are not captured in the national repositories of information. So we are now working with the Department of Planning, Research and Statistics so that the information capturing tools will actually be able to capture the local and community investment in health. In many cases where the communities are the ones now providing, even start providing water, providing gardening service, providing security, those are domestic resources, but we often do not capture that and report. So in many cases, our communities are actually doing much more than what is being reported because they are not being captured. And I can see somebody say that I'm not being honest in my reporting. Please, Olivia, please we give opportunity to that person to say what exactly I said that is not honest, because such a statement is too wide to be let go. Thank you, I'll stop here.
Yes, thank you very much, Ayo. We really appreciate your presentation. A lot of participants are saying that they really enjoy your presentation and it was brilliant. So thank you for teaching us about community-based monitoring. It is the position of most CSOs, what you actually said, and we actually are very happy to learn from you, from Cameroon, from Ghana, from Nigeria, and from many other areas. So thank you for sharing that experience. And just to also, Ayo, just to say that we will have a special webinar on community-based monitoring in partnership with ENEASO, and then we will also invite you to make a presentation, a detailed presentation on the great work you have been doing in Nigeria with Acronym and other CSOs on community-based monitoring, because in malaria is something that is very new. Many countries should learn from that and should also start being involved in community-based monitoring for malaria the same way they are for HIV and TB. So for malaria, we are not seeing that yet very well, but this is a key role that civil society, like you said, need to play to ensure that those mosquito nets are being used, to ensure that the community living in the most remote areas have access to quality malaria services. That is not just for people at the central level or people in town, but those commodities can go all the way into the rural area, into the villages, where it's actually where people suffer the most and die the most from this disease that we can prevent and we can treat in 3 days. So it's unacceptable that we still have people dying for a simple disease as malaria that you can actually treat in 3 days. So we need to actually engage communities and civil society better to play their role in terms of community monitoring. So we really thank you, Ayo. We're going to have a special webinar on that with ENEASO, and you will definitely be a key speaker, and we will allow a lot of minutes for you to be able to speak about community-based monitoring. It's something that we need to learn, and then you guys have started a very good job in Nigeria. So thank you very much. There were many questions for Ayo, some around tell us about how community-based monitoring works, how the funding works, how do you pay for data and all that stuff. I think we'll get back to that when we have the special webinar on CBM. And I don't know if other speakers want to, thank you so much, Ayo, thank you very much. I don't know if other speakers want to respond to other questions they've heard as well from the participants. This is the last section of our webinar today. So if anybody, any of the speaker wants to take the floor, please go ahead. Yes?
Hello? Yep,
yes?
This is Prince Lumumba from Uganda. Hello?
Yes, go ahead.
Okay, yeah. A question was asked about how the civil society in Uganda are not very active in malaria activities. Yes, thank you so much. That was a good question, but the person who asked didn't get the right words I used. I said civil society in Uganda are not very active in malaria activities. Yes, we have some civil society organizations who are doing some work in malaria, but the challenge is through the funding processes that we've been going through in Uganda. HIV/AIDS has been heavily funded by different partners, by even government programs and all that. So malaria was taken to be a government program. The mosquito nets, for example, of recent, we are just brought on board. Like I said, I'm in the field to see that civil society participate, to distribute and do all that. Yes, some organizations like World Vision and others were distributing even nets before, but was not particularly a malaria program. It was like they're caring for children and children need mosquito nets. So it was not particularly targeted to say this is a malaria program. So we are in the struggle to make sure that we bring on board as many civil society organizations working in health, but also to include a component of malaria and also get support maybe from like Global Fund, get support from other donors to make sure that at community level, we have specifically targeted programs with civil society on malaria. That is my response for now.
Thank you, Prince. Thank you very much. We appreciate your response. Are there any other speakers want to respond to anything else before we close?
Hello.
Yes, yes. Go ahead.
Hello. Yeah, I want to respond to the question which said, why should we work with the outgoing CCM members? I think working with the outgoing CCM members, it makes it easy for a new person in the board, because that outgoing member will give me too many clues on what I have to do for the sake of fast continuity purposes. I don't know whether I've answered the question.
Okay, thank you. Thank you very much. Are there any other speakers wants to take the floor? Then my brother Melwa, I will hand it back to you for the closing and maybe an overview for tomorrow. Thank you. Thank you all the speakers. Thank you very much. Thank you.
Thank you very much, Olivia, for actually taking up the question and answer session. That has been really, really helpful. Unfortunately, we were not able to have Edward Mwangi from Kenya to join us. Probably his other call has actually extended way beyond what he had anticipated would happen. So I want to say thank you very much. That marks the end of today's presentation, but I just want to let you know that tomorrow we have extremely exciting sessions again. We have really been talking about community rights and gender here, and we have actually really packed most of those issues to tomorrow. So we just want to say, please don't miss coming in tomorrow, same time, starting 11 to 13 hours East African time. And we are going to have such interesting sessions like the Global Fund Community Rights and Gender Strategic Initiative. We got to know what this is all about and how they are actually able to be supporting communities. We are going actually to have an introduction to the CRGTA, how you can be able to access technical assistance through the Community Rights and Gender Strategic Initiative of the Global Fund. We are going to have more information about the Anglophone platform, the Civil Society for Malaria Elimination platform. So please do not miss to be part of the discussions tomorrow. And with that, I would wish to say thank you very much for having been part of this conversation. And we hope to have you again here tomorrow. I want to say Goodbye and have a very nice afternoon and take care.
Great, thank you. Thank you to all the speakers and thank you everybody. We'll see you tomorrow, same time.
Thank you very much, Olivia.
Thanks, my brother. Have a good day. Bye, bye everyone.
Bye.